Welcome, Professor Rich RN here. I am an assistant professor in a school of nursing, and I'm also an NCLEX coach. My goal for you today is to walk you through some of the case studies that you might encounter on the NGN, which we all know is beginning in April 2023. So you're all going to experience 3 different case studies on the NGN. Within each case study, there's going to be 6 questions, so you're going to get a total of 18 questions involving these case studies. The questions that you get within that case study can vary depending on which item type you will get. So the first one that we're going to cover is a case study, and we're going to cover the case study select all that apply. So here you can see we have nurse's notes. We have a client that was brought into the ED by her daughter due to increased shortness of breath in the morning. The daughter reports that the client has been running a fever for the past few days and has started to cough up greenish colored mucus and reports soreness throughout her body. The client was recently hospitalized for issues with atrial fibrillation 6 days ago. The client has a history of hypertension, gives us some vital signs there. We have a blood pressure, pulse oximeter 94% at 2 liters via nasal cannula. Upon assessment, the client's breathing pattern appears slightly labored and coarse crackles are noted bilaterally in the lung bases. The skin is cool to touch, pale in tone, pulses are 3+ and irregular. Capillary refill is 3 seconds, and client is learn-oriented to person, place, and time. The client's daughter states, "Something seems like my mother is confused." So here in the case study select all that apply options, we have the case study, and we have to pick out what are those important things based upon that story. So if we go back to our options, we have vital signs, lung sounds, cap refill, client orientation, radial pulse characteristics, and characteristics of a cough. Okay, so 4 things we'd want to pick from. Immediately, we probably would say fever, so vital signs, lung sounds, client orientation, and then we can continue to evaluate that. But this is just an example question for that one. Okay, our next one I want to show, could be a case study, and it could be a follow-up to the first one I showed you, but this is going to be a different case study. But this specific item type is called a case study matrix multiple choice. So here, again, you're given information on that left-hand side. You're a nurse caring for an 82-year-old female client diagnosed with stage 5 Parkinson's disease at a nursing home. You have nurse's notes. You also have wound care notes. So you have to read through both of those things, and you need to determine what is the most appropriate or what is the priority, right? What kind of cues are they looking for? That's a big thing within that clinical judgment piece, is what type of cues are they giving us, and how can we pull that out? So then if we look over at what it's actually asking us, 7 different potential interventions here. And what this question is asking for us is to determine if that is an appropriate intervention or not. And then this is an example question. So that third column where it says results is going to be if it was correct or incorrect. Okay. So as you can see, the first one says assess peripheral briefs pads frequently. That's an appropriate intervention. So hopefully you would circle that box. Then you're going to perform passive range of motion exercise once a day. That's an intervention, but that's not really related to this patient who has a stage 4 pressure injury or pressure ulcer. So it's an inappropriate, so you would check that box. And then you would continue on all the way down. So there's essentially 7 questions within this one matrix multiple choice. And again, we're looking for cues and we're looking for that clinical judgment piece. Another item that you might encounter with your case studies is a case study with what's called a drop-down table. Okay? Here, you're going to have, again, some statements over on that left-hand side with some labs and some maybe additional labs, and then what you're going to be asked on that right-hand side is we have a couple areas of care. So if we're looking at, and what they're looking at here is for a GI system, you get to choose 3 options that would be an anticipated order. So as a nurse, what are you anticipating we're going to be doing for this patient? This would be, if we go back to our nursing process, this would be what are we planning for this patient? What kind of things would we plan for this patient, the planning process. So here you have 4 milligrams of loperamide, 17 grams of polyethyl glycol, which is Miralax, and then 40 milligrams of omeprazole PO. So which one of those would best help this patient based upon this story? And then you're going to answer each one of those based upon each one of those body systems. So again, multiple questions within that one specific drop-down table question, right? Just so you know, there has been a change on the NGN where some questions will, because there's so many questions within a question, some will allow you to get partial credit for these questions if you get some areas of them wrong. Another area that I wanted to evaluate with you guys today is a case study in relation to select all multiple responses, all right? So again, same sort of setup. We have a case study on the left-hand side. We have noted physicals, nurses' notes. We're gonna have vital signs. We're gonna read all that. And then we're going to, on the right-hand side, which will be our question, we'll have a question such as, which of the following assessment findings would require immediate intervention, okay? And so then you're gonna check these out. You're gonna go ahead and check, oh, that's important, oh, that's not so important, oh, that's important for this patient, their diagnosis. But you're gathering all that information based upon the nursing process that you utilized when you read through the case study. So if you're unclear about the nursing process, I would definitely recommend that you check out my other video on the nursing process and how we apply that to the patients, because it's going to be very important for these new case study questions. As I mentioned, within these case study type questions, there's going to be multiple different item types, okay? So another example we have is called the drop-down rationale case study. Same setup. We have the case study on the right-hand side. We're caring for a 67-year-old male client in the ED. And here we have the story that we need to look through. We need to look for those clues. We need to analyze. Remember, there's a whole clinical judgment model, okay? And I'm gonna go ahead and throw that slide up right now. And I want you to pause the video and go ahead and read through that clinical judgment model, because those are the steps that you should be taking while you're looking for these. Those are helpful tips along with utilizing that nursing process. Now that we're back looking at that drop-down rationale question, the question here is the client has been diagnosed with hypertensive emergency with evidence of retinopathy. Complete the following sentences by choosing from the list of options. The goal is to reduce blood pressure by no more than blank, and you click on that. It's a drop-down box, and so there'll be several answers within that. Within the first, how soon do we need to do that? And again, there's gonna be more answers. Blood pressure should be stabilized to within the next, and then you're gonna click however many hours. So again, that's a case study with drop-down rationale, how that would approach that one. The last one I want to cover today, and actually this one is my favorite case study new NGN type, which is called a highlight or a hotspot. So in this one, you're going to be given, again, the case study where you're going to have to read this patient's nurse's notes. And let's cover this one together, actually. A story, and you're going to have to read that story and highlight the abnormal findings or maybe what would require immediate intervention within that story. So here, as you can see that we have on the screen now, we have the nurse is caring for a 53-year-old male client in the GI surgical and oncology unit. The client is currently 12 hours post-op and undergoing a partial bowel resection and ileostomy surgery. Click the findings below that would require immediate follow-up. Your next step is going to be to go ahead and read that paragraph, and you're going to use your cursor and you're going to highlight the important abnormal findings that are going to require an immediate follow-up by you as the nurse. Again, this is in your clinical judgment. So you're going to read through the items that are the highlighted words here. Don't use this as a question for to see if you get it right, because there's just an example of what it would look like. Cannot guarantee the accuracy of what's highlighted in the text. It was more just for an example. But that one is what you would use for the highlight, or also known as the hotspot case study NGN question. Those are several different item types that you'll find within your case studies. I hope you found this video useful, and I hope you have a wonderful day.